Hello, and welcome to today's episode of A Cancer Conversation with the Georgia Cancer Center at the Medical College of Georgia. I am your host, Chris Curry. I am the Communications and Marketing Manager here at the Georgia Cancer Center, and today I am joined by Dr. Charles Freeman McCluskey. Dr. McCluskey, or Freeman as you go by, your middle name, is an incoming intern who is going to be working with our Urologic Cancer Care team. Now, not only is he a physician that's going to be working with cancer patients here, you are also a cancer survivor yourself. Is that right?
Yes, sir. That is right.
So, Freeman, thank you for joining us for this conversation. I appreciate having the opportunity. I always love sharing stories, and so I appreciate the opportunity to share your story, talk to you for a little bit today.
Well, thank you for having me. Georgia Cancer Center is a beautiful building and has been, the saving grace for a lot of patients for really, all this part of Georgia and the state as a whole and South Carolina. So it's truly an honor to be here.
Yeah, we do work very closely on both sides of the river because we are, we're located on the Savannah River here in Augusta. And so we see a lot of patients in Georgia, South Carolina, really all over. We don't necessarily focus on any one part of Georgia or any one part of South Carolina. We really go everywhere, and we try to bring patients here from everywhere. So it's awesome to be here, and it's awesome to have you here. Let's kind of dive in. Talk to me about testicular cancer. So you are a testicular cancer survivor. When were you first diagnosed?
Yes, sir. Well, it was in March of 2020, like right at the beginning of the pandemic.
Yes.
I was in Macon, Georgia at the time.
Okay.
And just studying, as medical students are
You
supposed to be doing.
were in medical school.
That's
yes.
right.
Okay.
And I noticed that there was a lump in the scrotum, and I tried to convince myself for several days that it was just an anxiety that was a figment of my imagination. But after a couple days, I was pretty convinced that I needed to get it checked out.
Especially being in the medical field,
Yes, I do like to say that I had not yet studied urogenital tumors.
Okay.
I give a lot of the credit to my pediatrician, Dr. Catherine Cheek in Columbus, Georgia, as well as another pediatrician, Dr. Nora No, who I worked with before medical school. I took a lot of care in noticing the way that I was counseled and other young men were counseled by the pediatrician about the importance of self-examination and that testicular cancer is a thing, and that if you notice something that's different, it is something you need to bring to your doctor's attention. So that I knew, at that point before actually studying those tumors.
So you found the lump. You finally convinced yourself to get it checked out. What happened next?
Right. So I went to the student health center because I was a student, and there was a lovely nurse practitioner who heard what I was saying, and we talked about it, and ultimately she agreed with, what I was thinking needed to be done, which was, get an ultrasound. I was told by the ultrasound technology team that was in Macon at the time that they were unsure whether, they were going to be even having patients come in because no one really knew what was going on with COVID.
Yeah.
So I feel like I kind of got in right before they closed the clinic for a little bit of time.
What a heck of a time to...
It was on a Friday, and then I got a phone call the next Monday that not only did I have a tumor in one of the testicles, but I actually had a tumor in each, which is very, very unusual.
Okay.
They call that a synchronous bilateral testicular cancer.
Okay.
It's very difficult to see that. That's not the answer on the test. If it's a unilateral tumor, it's probably testicular cancer. If it's a bilateral tumor, people are a little dumbfounded, and they tend to think that it's something else strange, going on, but not testicular cancer.
Yeah. So we interviewed Dr. Zach Clausen, who you'll be working with here during your internship. Last April for Testicular Cancer Awareness Month. April is Testicular Cancer Awareness Month. And he talked about testicular cancer being, so much more common in younger men. How did you feel when you found out? Because you worked in the medical field. It wasn't like you were, doing some other sort of job or interested in some other career field. You were in the medical field. So even though you hadn't studied, I have to imagine that you at least had a general knowledge of things.
Well, I was about to study it in 2 weeks.
Oh,
So,
wow.
doing a lot of research at the time of my concern was not a waste of time, you know. But I quickly sort of just familiarized myself with sort of a rudimentary understanding of the tumors and, testicular cancer and different facts about it, with the medical textbooks that were at my disposal. And the main thing that stood out to me was that these tumors are malignant until proven otherwise, which
Okay.
unfortunately for testicular cancer means that your testicle will have to be removed
Yes.
to really get a diagnosis. So you kind of go ahead and embark on some of the difficult treatment regardless of whether it actually is cancer or not. However, in a Caucasian person of my age at the time, I was 28 years old, there's over a 90% chance that it is malignant. It almost always is when the ultrasound gives that kind of intratesticular picture.
Okay.
They call it a hypoechoic image on the ultrasound. So it was, very clear to me from the internet that when you see this on ultrasound, it's almost always cancer. I'm going to have my testicle removed. The strange thing was just about why are there two of them? And the more I researched that, the more confusing it became. But the fact remained it's malignant until proven otherwise. So I was pretty sure that I was going to be having both of my testicles removed.
Okay.
And of course it took some time to get the urology care that I needed for someone to also realize that this was unavoidable and that, we needed to see what was going on in there.
So after your diagnosis, you sort of went into research mode using the information that you had at your disposal in your textbooks and on the internet, and knowing what sources to trust and what to look for.
I would agree with that. However, I like to say this to a lot of cancer patients early in their diagnosis, that Dr. Google is not your friend. Even someone in my shoes that had all these textbooks, of course I went to the internet and Googled. And, a lot of information that Google will tell you might be, hit the nail on the head. But there's a lot of other stuff that, had I not been in medical school would have been even more confusing to me.
Mm-hmm.
And it's it was something that, I read some stuff that made me think, okay, I'm going to be all right, even if this is cancer. This is a very treatable and curable cancer. And then, you read different stories that might be online from, mourning, grieving mothers and horror stories. So, the internet's kind of a dangerous place for a cancer patient because you're going to see a wide spectrum of stories and information, some of which may or may not pertain to you, some of which may just be completely fantastical and not based on any fact at all.
And it's really important for a cancer patient, even if they, because we can't tell them not to go to Dr. Google, because I think that is going to happen no matter how many times we say don't do it. So how important is it to have honest conversations with your oncologist about the things that you read on the internet, or that your sister or brother or wife or that they share with you that they read? Like, talk about how important honesty is with an oncologist.
I think it's hugely important, and I don't agree with this attitude which some doctors have, where they say, as soon as a patient starts to say that I read something on the internet, and they're just like, okay, I'm just going to tell you to quit reading stuff on the internet and just dismiss whatever their anxieties are that they've read on the internet. I think that's actually more important now than ever with the artificial intelligence that's coming out, because that's going to really, change the situation and the room between the patient and the physician, because, it's going to be a fact that soon people are going to ask really good questions to artificial intelligence, and that will be a lot better than a Google search, most likely, but also not perfect, and probably very confusing for the patient and maybe the physician too.
Because probably a lot of information coming out of it.
It can write you a 10-page essay, and you can say expand to make it a 20-page essay, and it does it in 1 second.
Yes.
So,
so talk about making your treatment decisions, because, concern about losing your testicles. Obviously, you said you were 28, so young, healthy, have your whole life ahead of you. When we talked with Dr. Clausen, we talked about preserving the desire for children later in life, potentially. So talk about how you made your treatment decision and the path that you took for treatment.
Right. Well, my concerns at the time were like a mixture between concerns for my life and my body and what was, the disease process that was happening. But then also sort of these other concerns that were not really related to the scientific situation at hand, like what is this going to do for my studies? How am I going to be able to stay a student while I am working? I didn't understand the way that life kind of has to go on pause when these things happen, and that deans and professors would be understanding, and that I did have to take time off from school and graduated a bit later because of this. But at the time, I was just wanting to get the surgeries I needed, get the cancer out of my body, and get back to school without being too behind, because medical school just feels like a fire hydrant of information, and we're all a little bit competitive with each other, and you just are realizing that everybody who's healthy is studying right now, and I'm over here kind of freaking out. But I think that that's true for all young men, regardless if they're in medical school or some sort of school, because life can be like a fire hydrant, especially if you're a young parent or you have an important job that requires a lot. So I've noticed that this is kind of something that a lot of testicular cancer patients feel, very overwhelmed about how am I going to put my life on pause.
How do you navigate that?
I think that it takes time. I mean, pretty soon your doctors kind of shift your focus to the real problem at hand, which is let's take care of this cancer situation. Mm-hmm. With testicular cancer, it's particularly unusual because since they developed these treatments in the 70s and 80s using platinum chemotherapy, this is one of the most curable cancers for most men with testicular cancer out of all solid malignancies. So it's kind of like when you go to an oncologist and you are needing treatment for testicular cancer, it almost puts a smile on their face, because they're like, this one, we're gonna have a party, a celebration, and they feel very confident. And there's not that many disease processes out there where an oncologist can say to a patient, you are going to be cured of your cancer, and not be in the back of their mind like, I hope they're going to be cured of their cancer. They the statistics are just amazing because of the chemotherapy, the way that these tumors are responsive to this chemotherapy.
Yeah, that's awesome. Walk us through, so, talk about your journey, your experiences with your treatment. What was that like for you? Because one of the reasons that we do, this podcast is to help educate people who may go to Google and search for information about XYZ cancer. And so, perhaps someone does a search and they land on this video, this interview. What was your experience in your journey like? And I know that not every experience and every journey is the same, but talk in some, generalities about things that someone newly diagnosed with testicular cancer that is freaking out and has 1,000,001 questions,
right,
what they can expect or know maybe going into their care.
Yeah, this kind of goes back to the question you asked about pathways towards treatment that I didn't really answer. So with testicular cancer, like I mentioned before, there's going to be an orchiectomy surgery. They call it a radical high inguinal orchiectomy, which means they're going to cut you a little bit below your belly button and actually pull your testicle out through the abdomen.
Okay.
And the testicle sits in kind of like a sock, if you will.
Yes.
So by pulling, it's called the spermatic cord. So if they pull that out, kind of like you're pulling a sock out inside out,
okay,
the idea is that any cancer that may have started to spread around the testicle or up that cord or in the lymphatic channels around it is still in that sock, Okay. So that's the way you don't get an incision in your scrotum like some people would think, know. And then after that, they're going to give you a phone call probably several weeks later to tell you exactly what the histopathology report is about that tumor. Depending on whether there's evidence of spread already and what we call the retroperitoneum and kind of your back and near your kidneys, or whether there's a really concerning sort of type of cancer that they find in the testis, they might go ahead and begin you on some chemotherapy.
Okay.
There's one type of testicular cancer where radiation is an option.
Okay.
It's not usually done in the United States, but it's still rather popular in some parts of Europe because it works for that one type.
Okay.
But the chemotherapy works pretty much for all the types.
Okay.
And so, you're more likely going to be pushed towards oncology than the radiotherapy, but there's still some options for that. And then in some situations, you get a second surgery, which actually Dr. Clausen, trained in Toronto, performs that surgery here with his Georgia Cancer Center patients. That's called an RPLND, retroperitoneal lymph node dissection. Okay. And that's a much bigger incision where they basically remove the lymphatic tissue from, the groin all the way up to the chest.
And do they do that to decrease the chance of of cancer recurring, or what's the reason for that?
Absolutely. They've got a lot of data over people being really excited about this disease over the past several decades because of the success rates. Success rates makes people really happy.
Yes.
And they want to even figure out what they can do better for prevention. But honestly, with testicular cancer, they've had such success with this disease that a lot of the research being done right now is actually trying to figure out how can we lessen the burden on survivorship, because these are young men, they're going to live to be old men.
Yes.
So they're going to have to live many, many years with whatever it is that this treatment might do to you in the long term.
Yeah.
So a lot of the research is actually not even as much pointed on treating the disease anymore. It's about lessening what they call the tumor burden and survivorship burden.
Okay.
So the chemotherapy, of course, has its own side effects that can last a long time, but also those big surgeries, like the ones, the RPL&D, which Dr. Clausen is very specialized in performing that surgery. That comes with some lifelong side effects as well, possibly. So they're trying to figure out ways that they can decrease that hardship that results from the cancer, because you're going to be living with it for years.
Now, you were in medical school. And you're obviously about to start an internship here at the Cancer Center, so you have chosen oncology as sort of your specialty, but did you always know, one, that you wanted to go to medical school? Did you know that you wanted to specialize in oncology? Was it this episode with testicular cancer that sort of drove you there? What was sort of your medical school journey like?
Yeah, well, I'll clarify. So I'm doing 5 years of training here in Augusta for urology, which urologic oncology, like Dr. Clausen does, it's a fellowship that you do after you've done the 5 years of surgical training.
Okay.
So I'm here to learn surgery. However, if God willing, if it's my path like it was Dr. Terrace or Dr. Clausen, I could become a urologic oncologist if I did a fellowship afterwards, which is 2 more years.
Okay.
Which means you're a surgical urologist who specializes in diseases of the urinary system and male reproductive tract. So everything from prostate cancer to kidney cancer to testicular cancer, penile cancer.
Okay.
But it's interesting that you asked that question, because before I started medical school, I read Siddhartha Mukherjee's book, Emperor of All Maladies, and I actually wrote about it on my essay to get into medical school, because it had a profound impact on kind of my scientific curiosity of medicine.
Now, I'm not familiar with that book. Can you give me a
So he is a really
summary?
famous oncologist in New York State who I believe Columbia, but I might be wrong about that. But he wrote a book that really kind of went off the charts because it's super well written. He's written several books since. I'd recommend all of his books. But it's kind of about the story of humanity and cancer. He very kind of dramatically paints this picture at the beginning of the book where they're looking at like Mesopotamian or Egyptian hieroglyphics, and there are diseases and there are treatments like, a rash, whale blubber, or, I made that up. But,
no, but I got you.
But there's one that clearly translates to a growing mass in the breast area, and it said, treatment, none, which shows that even back then, breast cancer was a burden, So it's like, oh my gosh, this story between humans and this disease called cancer that we generalize and call cancer is as old as time. And, you know, every president of the United States has promised we're going to cure cancer, and yet we're still kind of trying to figure out what is this disease and how do we put a cure to it once and for all.
Yeah.
And just kind of that epic story and all the brave and hardworking physicians and scientists that have been a part of all of the, treatments and progress that we've made, but also how much work there is left to do. It was super inspiring to me. And so I always kind of thought that I wanted to focus on cancer, but it was getting testicular cancer that made me say, I want to be a urologist. I want to tackle these tumors that involve this area of the body, which is where I had my tumors. Mm-hmm. And it just turns out that even if you don't do a fellowship in oncology for urologic surgery, I mean, about half or more of the patients that you see just as a general urologist has to do with a prostate cancer or kidney cancer, bladder cancer. I mean, this is a career where cancer is a huge focus.
And you can obviously refer those. If you decided not to do the oncology, you could
send them here to Augusta.
Yeah,
exactly.
You could absolutely focus on it. Okay. I know, so we talked about a five-year term here. What excites you the most about being here? Why did you choose Augusta University and urology to come here?
That's a great question. There are a lot of amazing programs, in the United States to become a urologist. But I would say that each one, kind of like a snowflake, like each program is not like the other. There's always a little bit of a difference. But for me, the program here in Augusta is really, really special because I'm from Columbus, Georgia. So this is like a very similar town to me as Columbus. It's just a bigger river and on the totally other side of the state.
Yeah.
But, to be able to receive the quality of training in such a, an individualized and specific field as urology in a town like Columbus, like Augusta, is, just perfect for someone who has that background and really wishes to go back into a community similar. I've always said that I hope to be back in Columbus, Georgia as a practicing urologist.
Okay, so
one
you
day.
do want to stay in Georgia?
Oh, absolutely. I didn't always believe that I wanted to stay in Georgia. When I was in high school, I thought I was going to get out and never come back. And then you kind of become an adult, and what is important to you might change a little bit. So
why did you want to stay in Columbus? Or why did you want to stay in Georgia? Why did you make that decision?
I lived in rural Tennessee up in the mountains, and I lived in Vermont, and I lived in the biggest city of Vermont, and it was still actually, because it's Vermont, it was still a fraction of the size of Columbus.
Yes.
And so I was like, this isn't quite big enough for me. I lived in Cameroon, actually, I was a French major, so I did some studies living in Central Africa, and I've seen my friends go to different places. Like, it was very trendy for people to move to Brooklyn or Denver, and I've seen different friends go to different places, and I'll visit them and see what their lives are like there. And ultimately, I'm like, I just like a town like this. The feeling that it has. As a physician, there's definitely a power in being able to understand the society and the city that you're living in, as far as relating to your patients and being able to ask them what part of town they live in and say, oh, you're right over there, or I know somebody else that lives over there. And you get to a certain level of a city, and it's just kind of a little bit chaotic and hard to.
Yeah.
That's my experience, anyways. But I guess I'm a medium-sized town kind of guy.
I like it. Okay. Yeah. How does it feel? What has sort of developed as your philosophy of care for patients, whether cancer patient or just a general urology patient?
Right. As far as caring for patients, I think the philosophy on the doctor's part should be, a patient first, always. Whatever it is that your patient is struggling with, not just their disease process, but sort of their own understanding of it, their mental well-being and spiritual well-being, their comfort level, that ability to feel that you've been able to convince your patient that they're in good hands and that there's a mutual trust there. this is, really important, I think, because a lot of people can learn how to do, very fancy and extensive surgical interventions, and a lot of people can learn how to come up with the right algorithm about what types of chemo need to be given in what order over what time frame. But to be able to hold a patient's hand through that all, because it's scary when you're a patient, and they're convinced I'm right where I'm supposed to be to get this treatment. That to me is the calling that physicians in cancer care should be following. And it's not for everyone, but that's kind of my dream, is to be one of those kind of doctors.
How do you want to build that trust with your patients? Because you're going to be seeing patients here during your time.
I think, by listening to them and getting to know them, really hearing what they have to say and what their thoughts are about it, and, just giving them that space, to share and to make decisions in that shared mechanism. There's an older sort of style of medicine where you sort of go to see the doctor, and the doctor tells you what's up and what you're going to do, and you say, "Thank you, doctor," and you leave. And that has proven to not be nearly as effective and not as ethically respectful as a shared conversation, and finding out, what it is that's important to the patient, because it's not the same for everyone.
Yeah.
What your goals and reason for being at the doctor, what you want out of it.
And talk about the importance of, treating, because we do that here at the Cancer Center. We've talked about it before, but talk about, what you learned, what you hope to do when it comes to treating that whole patient, their mind, their body, their spirit. What does that look like for you?
I mean, it really comes from a point of understanding, that you bring biases into a situation, and you can really misjudge a situation and really think somebody if you haven't put that hard work into getting to know your patient by listening is probably the number one thing. I mean, I really believe in the power of support groups. The Testicular Cancer Foundation is a small group, nonprofit group based out of Austin, Texas, that I work a lot with, and that's been life-saving for me, because testicular cancer patients get on Zoom every Thursday night, and we all just catch each other up on our lives, but there's always somebody new who's showing up scared, just got some bad news that they have something going on.
Yeah.
And then there's folks that are 50 years out of their treatment but still having some difficulties, or having no difficulties and just there to give advice and encouragement to younger folks. So it's that's been really, really huge for me, but it's not like every patient wants or needs that. And I was a lot of times when you get chemotherapy, they'll give you some sort of steroids to make sure that you don't have an allergic response to the chemotherapy, and it can those steroids can make you not sleep well, and make you, at least for me and several other patients, make you wake up in the middle of the night wanting cupcakes and brownies. So people think you go on chemotherapy and you're going to lose a lot of weight, and it's like, well, if you stayed on it long enough, you most likely would lose a lot of weight. But for a lot of patients, they actually gain weight.
Okay.
And at first, which is not nobody wants to gain weight, especially because they got sick and then now you're gaining weight. So, one time there was a patient that joined our support group, and he was so worried about starting the treatments. And I said, listen, you're not going to wither away, and if anything, you're going to get fat and happy. Well, it turns out like this patient had a huge history of being overweight.
Oh, wow.
So that was the worst thing I could have ever said.
Yeah.
He was just like, oh, I just don't even think I'm going to do the chemo. And I was like, oh no, yes, you got to do the chemo.
Yeah.
It's going to be fine.
Yeah.
But it was a real teaching moment for me. It's just like, not everybody is you. You got to get to know people, and show them you care about them.
Yeah. So when Dr. Martha Terrace shared your story with me and told me that we should consider interviewing you for the podcast, she talked about, your passion for outreach and awareness. And you talked a little bit about it with the support group and just even being a part of it. But why are you so passionate?
Well, testicular cancer specifically, going through an experience like this, you really want to make yourself available to be there for other young men, who are getting this news that they're about to have to do these bizarre treatments and that they never would have expected. There are certain things that come along with testicular cancer, like you'd mentioned before, family planning. It is really, really sad if a testicular cancer patient goes forward with surgeries and or additional treatments and they were never advised to go sperm banking, And I mean, sperm banking is a bizarre experience as well, but it's very important if that is something that the patient wants to be able to father a child one day.
Did you do that?
I did do that.
Okay.
But there's so many stories of patients who were never told or explained that now's the chance to do that. And if you want to do that, you need to do that now. And I don't know exactly why that failure happens in the system. If it's that some doctors are so focused on the disease that they forget the entirety, the whole of the patient's future.
Yeah.
Or if it slipped through an imperfect system. But that is something that I really, really, really hate to see. And, other things, just doctors who misjudge the situation and are not going about investigating it for what it might be and blowing off the patient saying, oh, you have an infection, here's some antibiotics, quit worrying about that. That disease is really rare. You don't have that.
Yeah.
And then that patient really does go home believing that doctor told them the truth and allows that cancer to continue to grow and spread and become a less treatable situation than it would have been at first because they got the wrong advice. So awareness about testicular cancer is a really big deal for me.
Yeah.
And then also the importance of self-examination. It's young men are always touching themselves at all variety of ages. So you're really already examining yourself anyways.
Yeah.
But just to be taught that this is a good thing to do. And, if you examine your right side with your right hand and your left side with your left hand and systematically do that, once a month in the shower when the scrotum's relaxed, then you're even more likely to be in tune with what's going on. I mean, if somebody notices something that is unusual, but they didn't even know that testicular cancer is a thing or were never told that self-examination is important, that also, I think, increases the chances for something to be diagnosed later. And then another thing is just like this idea that men are notoriously bad at going to get help, especially when it has to do with the urogenital area. They don't want to admit that they have a problem, or they just want to put it in the back of their head. That's like a culture change that we need to, address. So
I know you don't have the magic bullet, but how do we address that culture change?
You see a lot of men's health and women's health initiatives throughout the year. I think that those are oftentimes not necessarily geared towards the younger crowd. And this is a disease that predominantly affects a younger group of men. So I think that we need to celebrate men's and health, types of themes for awareness of disease and health for men's health and women's health. But we need to expand that and also really, really make sure that it's something that pediatricians are participating in, as well as young people at school or in health class, and parents need to know about this. And also there's some bureaucratic stuff, like there's the United States Preventative Task Force at one point said that there's no proof that doing self-examination actually decreases mortality, because even if you get this cancer, eventually we're going to find out, and we have a really high treatment rate. Yeah. And they even go to the point of saying that self-examination could lead towards an unnecessary demand for ultrasounds, which would clog up the pipeline. That's a sorry way to make a guideline. That's not the government. It's an individual entity, but a lot of weight is put on these folks who are making a lot of treatment sort of advice type guidelines that are not urologists. They are thinking about cost effectiveness almost completely, which is important, but an ultrasound is a worthwhile test if you might have a problem in your scrotum.
Yeah.
So, there's a little bit of, stuff like that I like to talk about too, because that I don't like to see any of that either.
Okay. Gotcha. Freeman, we've talked about a lot of information today, and I thank you for taking the time to sit down with me. As we start wrapping up, what would be your message? You have a platform here on this podcast, if someone's listening to it, they're newly diagnosed with testicular cancer, and maybe their mom or their dad or their brother, finds this as well when they're doing their own research, what would your message be?
My message would be take the situation seriously. Don't ignore this. Whether you're in the United States or in another country, there are in almost every country, there is an online community of survivors that, speak your language, that can tell you about what doctors are really, really good at treating this disease. So take a pause to, instead of try to solve the problem with Dr. Google, find a good doctor and come get care, because this is a really treatable condition if you do something about it.
Yeah.
It's not a good situation when you don't do anything about it.
Yeah.
So just to advise patients that it's going to be okay, but you do have to put your life on pause and go get care. And then second of all, I would just say just to have courage that having cancer is a scary thing, and it really kind of makes you think about your own mortality in a way that is not normal for a young man especially. But you can come out on the other side of it stronger than ever, with a perspective that your peers would not have for most likely several more decades. And you can kind of use the experience to hone in on what you care about and what you want to do, because you survived cancer, and now what are you going to do? And I would also just advise all patients, when you are on the other side of fighting an illness like this, don't just wrap it up and try to pretend that it did not affect you or have an impact on who you are, because it will. And turn that sort of impact into a way to be a resource for other patients, because there are patients right now, that have something that they know that's going on, but they don't want to tell anybody about it. And even if they do want to tell someone about it, they don't know how or where to go. And those folks, they need our help as caregivers. And I think that as survivors, we should all, be a part of that community that helps them get the care that they need. And ultimately, there won't be a need for these types of support groups and communities, because, of course, the goal is that we can figure out what causes these cancers and prevent them from ever occurring. But that's not the situation right now.
Yeah.
So just would encourage people to get help, and then, to be a resource for other patients.
Well, that's awesome and very helpful, I'm sure. Thank you so much for sitting down with me and for being willing to share your story, because I know that talking about cancer is never easy, no matter what kind of cancer it is. And so I just always appreciate having the opportunity to share stories about cancer and cancer survivorship. So thank you very much for being here today.
Absolutely. And I just want to thank the Georgia Cancer Center and Augusta University at Medical College of Georgia for hiring me and for hearing my story and for being a resource for patients, near and far. And, I'm just so honored to be here today and to talk with you. And I'm glad to be a part of the mission statement of the Georgia Cancer Center from here on out.
So good luck going forward on your internship and your time here.
Thank you, sir.
Take it easy. Now, remember, if you are not following us, if you have not subscribed, please do. If you have questions, you can email us at cancer@augusta.edu, cancer@augusta.edu. We do monitor that. We can certainly get your questions answered because we do want to share helpful information. So follow, rate, review, let us know how we're doing. If there are topics that you want us to discuss, you can email those as well. We have all kinds of cancer experts here at the Georgia Cancer Center. And so, it would be our pleasure to do a podcast episode with them. So thank you, and have a wonderful rest of your day.